The Physical Evaluation Test, or PET test, is comprised of a 3-cycle timed circuit obstacle course, simulating 4 typical physical labor tasks which paramedics must perform on a daily basis. These include strength, agility, anaerobic capacity, and flexibility. The City of Calgary EMS proposed the development of a job-specific physical ability obstacle course for pre-employment screening of recruits. Pre-employment screening allows the EMS to determine whether a worker is physically fit for employment based on a recruit's ability to perform job-related tasks. The nature of paramedic work dictates immediate response and reaction after possible long periods of sedentary tasks challenging a person's physical capacity with no warm-up or physical preparation. In order to go through and complete the PET test, there are a number of pre-screening items that must be met first off. The candidate must sign and complete a physical activity readiness questionnaire, which is a health screening tool. The candidate must also follow a number of preliminary instructions in regards to food, caffeine, exercise, and alcohol prior to the test. The client must sign a consent form which describes each of the testing items. A candidate must also have a resting heart rate below 100 beats per minute, and a resting blood pressure must be 144/94 and below to meet the safety requirements for the test. If a client does not meet the pre-screening criteria, they are unable to do the test, and they will require doctor's permission before they are able to go through the testing items. There are 3 main components to the test. The first, the obstacle course mobility run. The PET circuit consists of approximately 300-meter obstacle run where the candidate must demonstrate gross motor ability such as mobility, agility, flexibility, power, and general aerobic endurance. The second component is a strength station. It consists of a pull unit where the candidates will be required to suspend a 50-pound weight off the ground and travel through 4 180-degree arcs, keeping the weight elevated during the entire exercise. The third component is a body drag. The body drag session of the PET circuit requires the candidate to drag an approximately 90-pound dummy over a distance of 30 meters. A hose or weighted sled to 90 pounds may be used to simulate the dummy. The PET consists of these 3 cycles completed at a controlled pace. The course is laid out in the following manner. The first cycle involves the candidate traveling along a balance beam. After they complete the balance beam, they must go up and down a set of stairs 2 times. They then continue along the gym floor to a series of over and under stations where they must go over a box horse, followed by getting down to the ground and going under a couple of chairs that has a stick that is laid across. They repeat this again once more, and at the end of this station, they will then turn and go towards the pull station, the weighted station. After completing the 4 arcs at the weighted station, they continue along the gym floor, around a marker, back to the start. Once again, they have to travel along the balance beam. They skip the stairs, go all the way down to the end of the gym, and go through the over and under stations. After they complete the over-under stations, they will then drag the body or the hose the full length of the gymnasium. They will go around a marker to a sit-up station. They will attempt to complete 10 sit and reach sit-ups. And then they will go back to the beginning or the start. The third cycle is exactly the same as the first cycle. The applicant must complete the 3 cycles in 3 minutes and 30 seconds or less in order to meet all of the performance guidelines. The second phase of the testing involves an aerobic fitness test. The 20-meter shuttle run evaluates your aerobic fitness or work capability for physically demanding tasks on the job, as well as everyday paramedic activities. In this test, you run back and forth between two marked lines over a 20-meter course in time with audio signals recorded on a CD. The time permitted to cover the 20 meters at the beginning of the test requires a slow jog. Thereafter, for each 20 meters, the time between audio signals lessens, requiring that you pick up your running pace. The audio signal informs you of the stage you are at as the test progresses. The test ends when you miss 2 consecutive warning lines or you choose to stop. The applicant must reach a minimum level of 6.5.
Being able to extricate patients from a specific location to the awaiting stretcher and ambulance is an integral part of the paramedic's job. While paramedicine has moved forward to pre-hospital medicine in the past several years, physical endurance is still required by the paramedic. Not only is physical strength important, but flexibility and cardiovascular endurance is paramount. As we all come in different shapes and sizes, maintaining a structured form during lifting will aid us in the removal of the patient. 2 of the many devices used to extricate patients are the stair chair and the scoop stretcher. With the stair chair, the patient is sitting and is carried up the stairs by 2 people. Notice the good form of the arms of the partner carrying the patient backwards. The scoop is used to carry a patient that is lying flat out of a confined area or to ensure spinal precautions. Although the weight of the patient is distributed over a greater area, strength and cardiovascular endurance is extremely important. Whether a paramedic student or a paramedic, one must adapt and maintain a physical routine to allow the adequate strength and flexibility to perform the tasks required. Don't forget about cardio, such as jogging or other routines, as this is half the challenge.